Well, conflict of interest here. I am working at a school of public health, and public health profession has always been the best buy. We always have been the way to spend the least amount of money for the most amount of gain in the health system. Spending money on primary prevention of the behaviors and risks for health um, pays dividends for the Hong Kong health system. Here in Hong Kong, yes, it's a pretty large part of the health budget for the budget of the government, but it's growing faster than the GDP. And it will continue to grow faster, not just due to aging, but due to innovation and the intensity of new expensive drugs that the Hong Kong people will deserve to have and will want to have. The only way for Hong Kong to try to bend the cost curve so it doesn't grow faster than the GDP is primary prevention of disease. And guess which profession does that the best? It's the public health profession. We have in Hong Kong the Health Department of Hong Kong and the Health Bureau, which has a fabulous set of work that it can do to help Hong Kongers improve their lifestyles and health behavior. When we look at Hong Kong health behavior, it's actually quite good. Hong Kongers have one of the lowest tobacco prevalences, very low rate of alcohol intake, very high rate of physical activity. One of the issues for Hong Kong, one of the things that we want to invest in to help bend the cost curve is diet and nutrition. Hong Kong has a lot of room for improvement in the number of people in Hong Kong that have access to and ability to eat fresh fruits and vegetables every day. Probably because of the easy access of prepared foods and the difficult access for kitchen prepared foods. Our tight living quarters make it difficult to prepare food in the home. And so we have a difficulty getting Hong Kongers to eat fresh fruits and vegetables. There's so much that we can learn from other countries that have higher fresh fruit and vegetable intake. And one of the things that we can learn is the public health practice. What we do in public health is we learn from others. Neighbors learn from neighbors. Domestic helpers learn from domestic helpers on how we can bring in more fresh fruits and vegetables into the diets of our children and of ourselves, because we are now at a point where less than 5% of Hong Kong people are getting 5 fresh fruits and vegetables a day. So one of the best investments for preventing diabetes and hypertension, heart disease, and atherosclerosis and cancer is improving the diets of the people in Hong Kong in order to intake fresh fruits and vegetables. One other point is they're here. We have fresh fruits and vegetables. They're all around us. It's a matter of getting them into our diet and increasing the consumption of these really tasty products. So that's a great question. One important advantage of the Hong Kong health system is contact. So we have a public healthcare system run by the hospital authority, which has a lot of contact with the people of Hong Kong. Unfortunately, it's packaged into very short encounters with a health provider. A typical visit in an outpatient center is 5 minutes. Not enough time to talk about behavior. One opportunity is to look at other countries that say, okay, that busy healthcare provider really has to focus on disease and how to cure disease. But after that 5-minute visit is over, why can't we get that patient into the hands of a liaison worker, sometimes called a link worker, sometimes called a social prescriber, somebody who's not a doctor, but somebody who knows how to get that patient nutritional counseling, how to get them into a social group that can help share ideas on how to access and prepare healthy diets and promote that. If we did our job at finding these groups, and we do that in public health practice, one of the things we teach our students in public health is how do we make a list of the NGOs and community groups in every neighborhood that are able to promote healthy lifestyles? They're there. What we need to do is connect those assets, those NGOs that are busy promoting health behaviors, and get them to connect to that patient who's just leaving the hospital authority's general outpatient clinic. So that is a new small investment of a link worker. Somebody just says, okay, your doctor just diagnosed you with prediabetes or hyperlipidemia. We need you to get connected to this group of your neighbors who can help you access a better lifestyle. Not the time out of the busy healthcare provider, but time sending that patient to the hands of an NGO that is ready to help promote a healthier lifestyle for them. Let's say it's a YMCA, let's say it's a women's group, a co-op. These assets exist, and it's just a matter of creating that asset list. We're hoping that our new curriculum in public health teaches the future public health workers to do this. We need public health workers trained with asset-based interventions to help improve lifestyles. Better lifestyles can help lower the burden of diabetes, hypertension, hyperlipidemia, and cancer, so that the future Hong Konger is healthier than they used to be. They stay healthier, and they don't end up needing to go to see the provider. They don't end up adding extra costs. So investing in primary prevention with this workforce of public health is the best buy. It always has been, and it will continue to be. And it's too bad that too often the curative work, I've got the best treatment for cancer, heart disease, and stroke, ends up coming to where the money goes. And I can see why. I mean, they're all around this convention, people selling diagnostics and drugs. That's where the health dollars go. But if you're really smart, you say, what can I spend money on that would prevent that sickness in the first place? It's public health. So 2 pieces of data to share with your listeners. One is that interest in public health careers is increasing in mainland China. Our master's in public health degree has never had higher rates of application, but it's being driven by mainland Chinese applicants. Our local Hong Kong applicants are holding stable, but maybe not. I think there was a bump during COVID after Hong Kong residents understood what this profession was about, but those days are declining now, and we're getting back to pre-COVID levels of interest in the profession. The profession is not well compensated. Unfortunately, even though it's a best buy, the jobs in the health department have not kept pace in their salaries and compensation with clinical jobs. That can be fixed by the health department. If they realized how valuable this workforce was, they would invest in better compensation to pull more applicants into the profession. Mainland China gets it, and they are helping increase the number of workers in this profession. I would say that having our hospitals in Hong Kong invest in population health units, that's the way of the future. Around the world, we're noticing that hospitals, obviously their most important task is taking care of the sick, taking that acutely sick patient and rescuing them. They have to keep doing that. Yet there's a lot of money flowing through hospitals, and we're finding that hospitals do have the bandwidth to add on a population health unit that has the time to go out of the hospital, out to the community, and do what I just said, improve lifestyles, help the patients post-discharge adopt better lifestyles. If you're a patient in a Hong Kong hospital and you smoke, there should be 100% giving that smoking patient access to a plan to quit smoking and a follow-up visit to help those who do want to quit smoking. That's a best buy. In addition, those with nutritional challenges, with diabetes, hypertension, hyperlipidemia, again, a population health unit could follow up and help keep those patients adherent to their healthier lifestyles. The responsibility of the hospital, especially in a system with so much public money going into it, does not end the day the patient leaves the hospital. And I know that the hospitals think that they're so under stress and so under budgeted that that's all they can do to get you out the door. But for a little tiny bit of extra expenditure on post follow-up adherence to healthier lifestyles, the return on investment is so high, especially for Hong Kong. We cannot afford to let patients leave and get sick again. And yet we're doing it. And we can't afford to let that keep happening.